Yeah, so Ottawa, we are privileged in the sense that we serve a large area and we serve a population of about 1.5 million patients who all sort of come through the same hospital and get cancer care, which is centralized. So we have a great diversity of patients that we see here in Ottawa. And we also have a group of multidisciplinary teams here in radiation oncology, surgical oncology, medical oncology, and other allied health professionals where we can manage these complex cancers. And what has happened over the years is there's a clinical trials unit in the cancer center which treats patients with all sorts of different cancers. And over the years, we've had significant number of patients go on clinical trials to the point that I think Ottawa is now the second largest accruer to patients with cancer on clinical trials. And if you include the REACT program, which we'll talk about later, then we're probably up there being the highest recruiters of clinical trials in Canada. And what these trials offer to patients is if they've run out of usual treatment options, and there's really no other treatment for their cancer, then we can look for some newer treatment that has come out that has shown potential to work for the cancers, and we can identify that in the clinical trials. And sometimes it's a combination of drugs that already work, and we're trying to make it even better so patients live longer with reasonable quality of life. So what we have in Ottawa is a very robust clinical trials group, but now we also have the ability to use some of the technology in-house. So we have a molecular lab that can take patients' tumors, and we can sequence them in-house in Ottawa and get the results within days. And if you find a specific change in their DNA, then we can find a medication based on that change. If it's either approved, if not, then look for clinical trials which specifically target that change in the patient's cancer. We've come a long way in sort of molecular biology and specifically in molecular oncology over the last 2 decades. So I think the example we use is the first human genome that was sequenced about 2 decades ago cost over $1 billion. And now we're able to sequence a patient's genome for about $1,000. So over the last 2 decades, the technology has advanced so much that we can readily sequence patients' DNA. So that has helped a lot because obviously the costs before were prohibitory, but now we can sequence patients' cancer. So this was in 2000, and I remember back in 2006 or 7 working with some small sequences of cancer DNA, and it was hard to find. It was these large initiatives funded by multi-billion-dollar grants that were sequencing data, but now we can do that in-house and generate our own data in Ottawa on real patients. So it's come a long way, and the applications of it have changed a lot. So now there's interesting studies that came out in US where they're using a blood test to screen for cancers. So women undergo mammographies or a test in the stool, or you do pap tests to look for cancers. But now in the future, probably in the next 5 to 10 years, we would have a blood test that could screen for multiple cancers all at once.